Clostridium tetani is exotoxins producing bacteria that secrete the tetanospasmin, that is a toxin which bind to the component of a neurocytotic apparatus, blocking the inhibitory impulses to motor nerves that results in spastic paralysis. This bacteria have a unique property in this group, that is a terminal spore, which is also referred as a tennis racket or a drumstick appearance. The bacterium is also unique due to utilization of acycrolytic, the only bacteria that unable to utilize the carbohydrates or saccharides. There is 4 different points about this group. That group is involved in the neoplastic bacteremia cases, like Clostridium septicum is associated with the neoplasm, particularly colon and breast cancer, leukemia, lymphoma, and also the patient is neutropenic, and the only DNase positive organism is Clostridium septicum. Clostridium treatum can also cause the bacteremia in the patient with the malignancy, acute pancreatitis and neutropenic enterocolitis, and Clostridium rhinosums is resistant to rifampicin, and Clostridium pseudoli is a positive for the indole and urea. The Clostridium difficile is very important bacteria among the group. The bacterium is not be cultivated on routine culture. It has been cultivated in routine culture. Basically, the toxins of this bacteria is isolated by tissue culture technique, which is the gold standard for isolation of this toxin A and toxin B, and also we can detect by the PCR. The Clostridium difficile is associated with the antibiotic associated diarrhea, pseudomembrane colitis, and sedentary patient, the patient with 20 to 30% of normal flora of Clostridium difficile. Toxigenic strain causes mostly toxin A and toxin B. Cycloserine, cefoxetine, fructose agar is a selective medium for the Clostridium difficile. Acetylcholine positive, weak mannitol reaction, and both cycrolytic and proteolytic. There is some group in that has been differentiated on the basis of their ability to utilize the saccharides and proteins, and this group you can see this group here, and this group, the Clostridium biofermentans, which is subterminal spore, and indole positive, and lecithinase positive, and urea negative. These are the group. They can utilize both saccharide and proteins, and below there is a group that is only utilize the saccharides, that is Clostridium bartai, Clostridium botulinum, Clostridium colostrum, and Clostridium glycolium, Clostridium ammonicum, and this group do not utilize the protein present in the medium. This is a very huge group, and you can see it clearly from here.